Have you worn a night guard and still getting jaw pain? You've tried the exercises, you've visited the dentist, maybe even physical therapy, and nothing's really worked? Well, the problem might not be totally coming from the jaw. It may be your upper neck, actually. There's a really unique connection between the upper neck and jaw dysfunction. And that connection is in the brainstem, and it's called your trigeminal cervical nucleus. And so if you've been to the dentist, you've done the exercises, you wear the night guard, and you're still having an issue, the problem may be a sensory mismatch coming from the upper neck, which is why upper cervical chiropractic has a good track record of success with chronic and stubborn jaw tension and jaw pain problems. Things like popping, clicking, grinding, trouble opening your jaw all the way, jaw pain combined with headaches, all those symptoms that people get with stubborn jaw pain are many of them are related to the upper neck. And so what they did with different research studies and different anatomical studies, and they looked at how exactly is the jaw and the upper neck related functionally. And that trigeminal cervical nucleus is the answer. Sensory information from the face and the jaw enter into that brainstem nucleus. And then sensory information from the upper neck area, C1, C2, and C3, enter into that same nucleus of nerves, the trigeminal cervical nucleus. And C1 and C2, the top two bones of the neck, have unique names, atlas and axis. And if you do a little research on Google and you type in TMJ and atlas adjustments or jaw tension and upper cervical, you're probably going to see a few case studies or people talking about that connection and how it, working on the upper neck helped their jaw problems. And so here's why this happens, is because in the studies they did, they looked at people that didn't respond to the usual treatments with jaw problems, and they found those people had a fixation, a joint problem in the upper neck. So they worked on the upper neck, and like magic, except not, their jaw pain got better. And they also looked at people that had upper neck problems but didn't actually report having any symptoms with jaw issues, not yet anyways. They studied the jaw and how their jaw opened and closed and their bite, and they found problems even though they were sub-symptom, or not quite symptomatic yet. They worked on the upper neck of those people, and lo and behold, the function of their jaw improved, even though they weren't complaining about jaw problems, which solidified this idea that there's something going on between the upper neck, the nervous system, and the jaw. And so how we figure out if that's happening with patients that come into our office, we don't just assume every patient with jaw tension or jaw pain or popping and clicking has an upper neck problem. We encourage them to go consult with a dentist or a physical therapist that also works on jaw problems. Many of them, though, before they ever come to see us, already have, and that's why they're looking for help still. They're not looking, they haven't had the long-lasting results they're looking for. They've already had the night guard and all these things. So we run these patients through a screening test. We very, very carefully look at the function of the nervous system, and we use a test called infrared thermography. Infrared thermography is a functional, real-time data test on the nervous system, which we do in the office when the patient comes in. And it helps us figure out if that nucleus of nerves in the brainstem are controlling the jaw area normally, and that lies within the autonomic nervous system. So we test the nervous system when they come in. If we find there to be a problem there, we'll take x-rays of the upper neck. And the x-rays that we take aren't just your typical x-rays where you take one from the front or one from the side. We take what's called biomechanical x-rays, which means we have the head and neck in different positions to look for fixations in the upper neck. You can't tell if a joint is stuck if you never try to, if you never attempt to move it. So we have the patient put their head and neck in different positions to look for that fixation in the upper neck. If we find a neurological problem based on thermography testing, and we find a fixated joint based upon biomechanical x-rays, and the patient also exhibits some of the same symptoms that we would expect with this jaw dysfunction, we do a very careful examination of the head and neck and their range of motion and their posture and a few orthopedic tests. And if all of those tell us the same story, we put together this clinical picture of what's going on. Then we let them know, okay, we think we found the problem. Then we make these very careful adjustments to the upper neck, not on every visit. We don't. The goal of the treatment isn't just to blow up the neck with a bunch of adjustments every time they come in. There's another video on this website or on this YouTube channel that you can find that talks about what upper cervical chiropractic is and how it's different than regular chiropractic care. But when necessary, and very, very carefully, we make very precise adjustments to either the atlas, the very first bone in the neck, or sometimes the axis, the second bone in the neck. And then we'll go back and we'll retest the nervous system function again using thermography. And over a series of appointments, some with adjustments and some without, many of these patients who came in to see us with chronic jaw popping and clicking, chronic jaw tension. They wake up and their face is sore from all the tension. Maybe they couldn't open their jaw very wide, take a bite of an apple or a hamburger. Many of them report those symptoms begin to go away and stay away. Not because their jaw got fixed, but because the upper neck, where the problem really was, finally got addressed. And that neurological connection between the upper neck, the nervous system, and the jaw was finally normalized. And that's how they got the long-lasting results they look for. So in summary, sometimes jaw issues can be rooted in the upper neck. And through very careful testing and very careful adjustments, we can treat the upper neck and help somebody with jaw tension and jaw pain and headaches and things of that nature. All right, if you have any questions, you're always welcome to reach out to me here at Source Point Care in Chico. We have a website. We have more videos on this YouTube channel. We hope to see you around. Take care.